Well, I think there's a, I think for me, it would have to be the fact that there's this idea that we have free health care to take care of all of our needs. So a good example is, I've had a kidney transplant. I now have to take um, anti-rejection medication the rest of my life. If I were to live on the reservation, that medication would come to me for free. I'd have that there. But because I live here, I have to pay for it like everyone else does. And so that's something different.
Sure, and people could assume completely opposite.
So I'd like to see the fact that, I could have access to that as well, even though I live here.
Okay.
To me, a lot of times as Native people, you can't just ask us, oh, hey, what's wrong with you, and get a short answer. Especially for older people, they're going to tell you a story about what's going on with them and what their symptoms are and how they're feeling. And it might not take 15 minutes to do that, right? They're used to being able, especially when you go talk to the medicine person, they're asking you a lot of questions about what's going on. You're telling them about what's happening to them. It's not just, here's how I feel, this is what's happening, you're in, you're out. To me, I think the most important thing is that, we're resilient people. We are still here, even though people have tried to kill us for hundreds of years. And that all of this information about how to be healthy and how to be happy and how to be whole, we have that knowledge within us. And so I think it's hard sometimes when we go and talk with mental health people or with medical people, that the idea is that the doctor has all the knowledge and the stuff that we think about how to be healthy is wrong or is crazy, And so I think that we are headed in a different way. I have heard more about, the medical field understanding that ceremonies are important to us and that this is something that is just as important as going to the doctor sometimes, or can be done together with going to a regular doctor or going to the hospital.